Hey, this is Dr. Ryan with the Chiropractic Spa. We're going to talk about the most mobile joint in the body today, and also perhaps the most complex joint in the body, the shoulder. So the shoulder is actually not one joint, but it's actually four joints together that come to make the shoulder girdle. So it's incredibly complex, and I'm going to give you a little bit of an idea of how complex this is. We're going to go over some of the anatomy. So you have three primary bones that create this shoulder girdle. You have your clavicle or your collarbone, you have your upper arm or your humerus, and then back here, and my range of motion is not great, but I can still touch it, it's your shoulder blade or your scapula. So each one of these bones comes together to form four different joints that involve the shoulder girdle. So the first joint we're going to talk about is the sternoclavicular joint. So it's where the sternum meets the clavicle. Then you have the acromioclavicular joint. So you have the acromion comes from the scapula and kind of meets right here on top, and the clavicle comes right here. So it kind of bridges and makes a joint like this, and it looks like two prongs of a fork looking at you, and they're actually attached through different tendons in there as well. Then you have your glenohumeral joint, which this upper arm attaches to the scapula at a glenoid fossa. So it's kind of a ball and socket right there. And the fourth joint that people just kind of ignore and just don't think about very often and goes undiagnosed more often than that is actually the scapulothoracic joint. So the scapula sits like this. It's like a suction cup on top of the thorax or your chest cavity, and actually suctions there and creates a gliding motion. So what I see a lot of times is actually a muscle inhibits that gliding motion, and that can actually produce pain. A little bit more to show you how complex this joint is, there are 17 different muscles that attach just to the scapula. So this bone right here has 17 muscles that attach to it. We take a look at all of them to see which one may be reducing your function, reducing your ability to perform basic movements, so that we can fix it and correct it so that you can get back to doing what you love. A lot of swimmers experience a lot of shoulder pain because they can't get up. For me, it's my left shoulder. I have a torn labrum, which is another tissue involved in the shoulder. And so when I do my forward crawl, I can't get my left shoulder as far back as my right shoulder, which actually makes things a little bit difficult for me. And when you're swimming open water and you can't breathe to your left and you're swimming south, you always get the water in the face when you get a wave. So what we've done and what I've done is actually worked on the shoulder because it used to be far worse. We've done a lot of rehab exercises, a lot of strengthening to ensure that mobility and all the muscles are engaging properly and coordinating correctly so that I can return to my full range of motion. I'm getting much closer, but I'm not there yet. And then also restore function and reduce pain. So what we do is we look at the joint separately. So we look at each one of the joints, assess each one of those joints to make sure that they're not restricted and causing pain down the line. Believe it or not, the sternoclavicular joint right here actually can produce a lot of pain in the shoulder. So we want to make sure that each one of these joints moves on its own and independently, but then as a part of that cohesive shoulder girdle. We'll also look at all the muscles, and we have a lot of tools to assess the muscles, but then also a lot of tools to help produce function and produce movement, and to dampen and decrease the pain. So we'll take a look at that. But then also, one of the big things that a lot of people leave out in a lot of different fields, we want to take a look at the spine, especially the upper back, because the nerves that actually control the shoulder and a lot of the function of the shoulder girdle exit from the spine. If you have actually a disc bulge in the lower cervical spine, you'll actually probably have pain in your shoulder too. So we want to assess the function of the spine as well, which is obviously what we as chiropractors specialize in, and that's what we all start learning when we're in school. And each of us kind of can specialize in different things in different areas of the body. I chose to specialize really in the extremities because I love working on shoulders, ankles, knees. If you name it, I probably really enjoy working on it because it's complex and it makes a puzzle, and I love reading and doing puzzles and reading and figuring out where things are going and what's going on so we can get you back to your function there. So come on in, let's do assessment, see what's actually causing the pain in the shoulder, and get you back in the game.